hyperparathyroidism would be that calcium. And it's actually called resorption or bone resorption, which means bone breakdown, and then we reabsorb that calcium back into our blood levels. So whenever you hear about bone breakdown, it's usually called bone resorption, not reabsorption, resorption.
And that happens because of the
hyperparathyroidism, yeah. PTH. And then the bone metastasis is bone cancer.
Okay. So
Yeah.
is the bone resorption just something your body automatically does?
Yeah, a little bit. Like we constantly have osteoblast and osteoclast activity like all the time. Like our bones are always breaking down, fixing themselves, breaking down, fixing. But when we have like the hyper, it would just be too much. So it would be like too much of an increase.
Right. Okay.
They're not building up as much as they're breaking down. And that's kind of what, so the next one, prolonged immobilization does. Because when we actually walk and we like put pressure on our bones, that causes them to start building up and like fixing themselves.
Okay.
And so when we're in bed, our bones just kind of like waste away.
Do they become like mush?
Kind of, and so any type of prolonged immobilization can cause an increase in calcium because your bones, they're not having any stress put on them, so they're not going to have the need to like build and use the calcium that you have.
Okay, so just getting rid of all of that.
Yeah, bed rest, you're at risk for hypercalcemia. Yeah.
So will going through like range of motion exercises help with
Yeah,
that?
definitely. Yeah. Teaching the patient to do as much as they can, even like pushing against the footboard, anything they can do. So you guys are going to learn about osteoporosis later, not on this test, but in a few tests. And that's actually one of the ways to treat osteoporosis and calcium, high calcium levels in the serum, because teaching them to put weight on their bones. Go for a walk 3-4 times a week, that kind of thing. What about excessive vitamin D? How is vitamin D linked to calcium? Maybe not the activator, but it allows for the absorption in your intestines. Remember the GI tract? Yeah. So that one's important to know. Oops, I forgot to write the time on the last one. Okay. And then osteoporosis. It's just pretty much like the breaking down of bones. Bones are weak, and so that would increase the release of calcium into our blood. So all of those are causes.
So
I don't know if you guys see on how it says like reflex, nerve, muscle. Like pay attention to those because it kind of helps you realize mainly what that electrolyte is dealing with. So like sodium was in, out, shift. Like we eat it, we pee it out, or it shifts in and out of our cells. Like just it kind of helps you. But did you have a question, Ashley?
yeah. So with hypercalcemia, that's the calcium breaking from your bones, and hypo would be
Putting too much in. Yeah. Mm-hmm. Which, if we look at the causes, so not really is it ever, maybe some type of problem would cause like too much building up of bones, maybe like some types of bone cancers. But usually it's just because there's nothing there telling the bones to break down, like the parathyroid hormone. So usually it's because we've removed the parathyroid glands. So it's not getting signaled to cause bone breakdown, to get calcium. So the removal of your parathyroid hormone. And then why would renal failure cause hypocalcemia? Does anyone know? Hypocalcemia, why renal failure would cause that? Renal failure. So what is our kidney doing with renal failure? It's not really working. Yeah. So remember we talked about with hemodialysis, the kidney has other functions other than just like peeing things out. It activates vitamin D. So if I'm not activating vitamin D because my kidney's not working, I'm not going to be able to reabsorb calcium through my GI tract. So that's why renal failure can cause hypocalcemia, because I'm not activating vitamin D. And then you know that increased phosphate causes it because the inverse. What was that?
Sorry. So you're saying the kidney activates vitamin D?
Yeah, and
Okay,
so when I'm in
it's
renal
fine.
failure,
Okay.
it's not doing its job. It's not activating it. Yeah. So kidneys are amazing. They have lots of functions other than, fluid balance and stuff. So, and then like signs and symptoms. Treatment, so calcium gluconate, which is the which is the antagonist to magnesium sulfate, so kind of an interesting relationship there. Yeah. Okay. Definitely focus on the nursing implications. So I don't know if you guys see it. I'm on slide 50 where it says calcium gluconate and then it has nursing implications underneath. Pay attention to that, like in the drug book. So, do you guys want to go over that now, or do you want to look up in your drug books later? We can talk about it later too if you want. So, see, here it is. Below 6 and above 12, death on that slide.
For
Calcium. So our normal range is that 9 to 11, but then below 6 or above 12 is death. So if you ever have a question, you might have a question about, so below 6 or above 12 would lead to death. So that's important for you guys to realize. That one's just kind of like a review. Any questions about calcium so far? Thought he was coming in here. Any questions about calcium? I think so. And I know you guys are going to talk about it a little bit tomorrow. So